The following program is sponsored by Lexington Plastic Surgeons.
We often hear that beauty is only skin deep, but if you have unsightly scars or suffer from keloids, you may be struggling with your looks, and you probably find it hard to feel comfortable in your own skin.
Over this next half hour, I'm not only going to tell you, but show you that you no longer have to suffer in silence, because there is hope.
Now what I know about keloids is that I don't have to live like that. If I get one, I can also have it removed. That's what I know today.
Today, through Dr. Jones and his staff, I realized that there are opportunities to have those scars removed, and that it's not something that you're forced to deal with, that you do have options.
The first thing I look at when I'm in the mirror, I look at where the bump used to be, and I'm saying, thank God I got the bump removed because I don't have this thing on me anymore.
I could do whatever I want to do now. I could have my hair up, I could have my head down. I feel more confident. I just feel elated.
I'm Cathleen Trigg, Emmy Award-winning journalist, television personality, and actress.
And I'm Dr. Michael Jones, a board-certified cosmetic and reconstructive surgeon and founder of Lexington Plastic Surgeons. I devoted my entire career to making people happy by changing the way they look on the outside and feel on the inside.
We recognize Dr. Jones as one of the most formidable physicians in the country who recognizes the problem and really knows how to treat the problem. When we met Dr. Jones and talked to him for such a long period, we understood what his goals and objectives were, and it's clearly to help people eradicate themselves of these keloids.
Aside from being a leading cosmetic and reconstructive surgeon who has been featured on television and in magazines as the go-to doctor on many medical issues, you also happen to be my husband, and so I get a chance to see the amazing work you do on a daily basis and how much you truly have changed lives.
Thank you, Kathleen. As the founder and director of Lexington Plastic Surgeons, I've treated thousands of patients, from celebrities to anyone who has wanted to enhance or correct something on their body. A large percentage of our patients over the years have been people who suffer from keloids, and they come to us desperately seeking out treatment options. In fact, it was seeing how many people are suffering with keloids that led me to develop the keloid treatment centers all over the country.
It's really unbelievable to see how many people really are suffering, but it's also amazing to see what a difference you have made in so many patients' lives with your breakthrough research and treatment options. Let's start by just explaining what a keloid is for those people who may not know.
Keloids are benign fibrous tumors. They are an enlarged growth or scar at the site of a wound or cut that extends beyond the confines of the original wound. Keloids are the result of abnormal wound healing. Thus, they may form early, or they may take a little while to develop. It may take several months or even years to develop. Even a minor skin abrasion can result in a keloid formation. Normally, there's a balance between the production and breakdown of collagen. Now, collagen is a protein that makes up the fibers within the skin. But with keloids, the cells in the skin, called fibroblasts, produce excessive amounts of collagen. The collagen fibers are also thicker, tend to be wavier, and this leads to a thick, raised appearance that is characteristic of keloids. Keloids can differ in their size, their location, as well as their shape, and are common on the hands, the lower legs, the mid-chest, the face, or even most commonly the ear.
Now, in your practice, I know many of the people who come to see you are patients of color, and I've also heard that patients of color are more prone to developing keloids. Is that necessarily always the case?
Well, yes. People of color, Africans, African Americans, Hispanics, Indians, Asians, are most affected with keloids.
I know one of your patients in particular is Hyacinthia Leon, or Cynthia as she's known to her family and friends. Now, Cynthia is an ICU technician who suffered from keloids for over 12 years. Let's take a listen to her story.
How are you feeling?
I feel great, actually. I feel wonderful.
I used to comb her hair for her, and I noticed the bump was there, right there, yeah? But she's always used to like, careful, 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 the bump, you know? She would hold it like this while I combed the rest of her hair, and it was very sensitive.
When I first noticed the keloid at the back of my head, it began with a little bump, and then like weeks after, it started to get bigger and bigger and uglier. I am the only one that ever had keloids in my family, and I find that kind of strange. I was like, why me? But it's just That's the way it is.
Up until that time, I didn't know anything about keloids. I saw the bump when I was combing her hair. I didn't even know what it was. I thought it was just a growth. You know, I wasn't even self-worried that it might be cancerous or anything. You know, I never gave it a thought.
My friends and other doctors that I have been to told me it was a big overgrown keloid. It itches, it burns, it bleeds sometimes. It prevents me from doing a lot of things like having my hair up or going to the salon. I did not socialize much. I did not feel like doing much of anything. Because the first thing my friends and other people notice is that big bump at the back of your head. So with just that, I just basically stayed home a lot.
So since you have some medical
the day of the surgery, I was very nervous. I had no idea what to expect. No idea. I was like, is it gonna be a big scar, a little scar? Am I gonna feel pain? The surgery wasn't bad at all. Nothing that I was expected, like something's gonna happen, I'm not gonna wake up from anesthesia, nothing like that. If most doctors knew about the SRT treatment, most keloids will not grow back, because I have a lot of friends that did the keloid surgery and the keloids end up coming right back and twice as big as it was from before. So if most doctors had that kind of machine in the office, it would be better for a lot of people that have keloids.
Before the surgery, she was kind of shy, and she would never let people see the back of her head, you know. And then after the surgery, she has her hair up. We went to Atlantic City and her hair was up. I couldn't even tell where she had the, you know, where the scar was.
Lexington plastic surgeons and Dr. Jones are awesome.
I would recommend Dr. Jones to anybody because he did a fantastic job on my sister.
They make you feel so comfortable. It's like there is no question that you can ask them and they cannot answer.
She has her confidence back. That's really all that matters. She's a better person. She's a better person.
Wow, what a great story. I mean, it's so nice to see Cynthia and that great big smile light up as she talks about how amazing you are. Now, she did mention that occasionally her keloid would bleed or itch. Is that something that's common in patients?
Itching is actually a telltale sign that the lesion or scar is actually continuing to grow. Many scars that are starting to become keloids will first start out slightly elevated. They may start to itch, sometimes bleed, or even cause pain as the growth continues. Some keloids may even entrap hair follicles and lead to a smoldering infection with foul-smelling drainage and even pus.
It's really something. I often hear people say that keloids are running in their family, that their parents had them, their grandparents had them, and now they have them. Is it hereditary, or does it depend on the individual?
Doctors may not fully understand the biology behind keloids or why some people keloid while others do not, but what we do know, besides inflammation being a cause, most people that have a tendency to keloid usually have a family history of keloids. In fact, allow me to introduce two of my patients, Veronica Brown and Joseph McQueen, who sought help for keloids that not only affected them, but members of their families as well.
Like this?
There you go.
What letter?
J.
J. Okay.
My grandson Joshua, when he first seen it, I was taking my work shirt off, and he said, "Oh, Mama, what is that?" And it was his face, and I said, "Oh, that's a keloid."
On her back, I thought it looked to me like just a hump. I had no idea where it had come from. Or what it could be. It was a complete mystery to me. Mom, do you know there's something growing on your back? What is that?
The keloid, it was like a buffalo hump on the back of my neck. And when the first doctor went in and cut it straight across, she only cut a small piece of it out, a piece of fat, which looked like a magnet. And when she removed it, I thought I was okay. And then a year later, it came back, and I wasn't happy.
My mom felt that her keloid was something she had to deal with. She wanted to fix the problem. It was, for us in our household, the big elephant in the room, so to speak.
The keloid is a massive fat, and mine was a straight line going straight across the back of my neck from the surgery that I had when they cut me. And I didn't like it, not one bit, on the back of my neck.
I definitely think that it affected the way she felt about herself. I feel that she would dress in a certain way to kind of cover it up. She didn't feel comfortable with people seeing her in certain shirts, especially if the back of it was low cut, so that it would be exposed.
My hair, I would just wear it long all the time. Would never ever wear it short because of it.
So it definitely affected my mom's confidence level. It affected her dress, the way she carried herself, and everything.
What's the new letter? What's the other letter?
M.
Don't give me M again. You can try to be funny. That's not funny.
Before Dr. Michael Jones, I had the first surgery. The first surgery was not good. I thought it was gone, and then it started coming back. I needed to find the right doctor, and I didn't know which direction to go in. I didn't know who to talk to because I wanted this keloid to be gone. Like, just cut the middle piece out so it can be gone, so it can be flat. So I was sitting under a hairdryer, and I was going through the pages, and I seen Dr. Michael Jones, specializes in keloids.
You know you did a wonderful job.
Oh, well, thank you so much.
Everybody.
You did a great job.
I said, he can help me. And I called right up under the hairdryer. And that was the best thing that could have happened. Came in for my consultation. He looked at it and he said, no problem.
My mom loves Dr. Michael Jones. She's had various surgeries with him. The keloid was just one of a few with him. And from what I understand, she said any surgeries that she needs, she wants to go back to the same doctor.
You know, the other doctor, I couldn't move my neck for a couple of weeks. You know, it just wasn't good. And so now it's been about 2 years since I had it, and I'm not looking forward to it ever coming back.
Now that the keloid has been removed, my mom has a shopping habit. She loves to wear clothing that she wore before the keloid. The keloid kind of took over her wardrobe. So now she has no fear of, you know, what if someone sees my back?
When I go out, and when I was on vacation, that was the first time in a long time that I was able to have my hair up in a bathing cap and not someone look at me through a key, you know, looking at the keloid.
We went to Disney World together, and my mom felt free. She felt confident and comfortable in her clothing, her bathing suit, and everything that she had the opportunity to wear.
Dr. Michael Jones, I recommend him to all my friends. He's been working on me a few years now. I wouldn't go to anyone else.
Well, I'm sure glad that Veronica was able to feel comfortable in her clothes again and have the keloid, or buffalo hump as she referred to it, finally removed. But it took 2 surgeries. Is that common with your patients?
Exactly. Her first surgery by another physician did not prevent her keloid from growing back. And that's common for people to enter my office frustrated that their previous operation was not successful over time.
Now, the second patient that you spoke about having keloids, which also runs in his family, was Joseph McQueen. Now, Joseph's father had keloids, and for most of Joe's life, he has also suffered from keloids. In fact, he has several keloids on his chest, making it really hard for the avid bodybuilder to show off his buffed body.
I first noticed the keloids approximately around high school. I would say I was probably 16 or 17, and on my chest, I realized that there was a scar forming, and at that point, I couldn't trace it back to any particular incident or injury. From that point on, as I went through college, I noticed that there were several others that were beginning to form. I grew up in the inner city, and usually in Jersey City, there's not much grass around. You know, there was a lot of concrete, not too many parks available. And when I would fall, or around horse playing and things like that, I noticed when I would fall in the scar that the scars would somewhat begin to elevate. They didn't flatten out as I would expect. There is a history of keloid in my family. My father, he had keloid scars, And I noticed that growing up, so I knew that there was a possibility that I may keloid as well. With the keloids in working out, it does present a conundrum there. You look at the scars and they're in places that aren't ideal. And once you take into consideration the training that's necessary to build quality muscle and to have something that's somewhat something that you appreciate and that you kind of want to share and be confident in, to kind of have that hampered by scarring that may be in those regions, whether it be your chest, your arms, so forth. I would say I was definitely self-conscious about the scars there, and ultimately, what would be the best way of possibly hiding or masking the particular scars, whether it be with jewelry or selective clothing or things of that sort.
Hi, welcome.
I found Dr. Jones and Lexington Plastic Surgeons. One time I was searching the internet and I was just researching keloids, looking for new innovative treatments or maybe some self-treatments that I could do to kind of minimize or reduce the scarring or the elevation of the keloid. And I was able to come across this new SRT treatment, which Dr. Jones and Lexington Plastic Surgeons were providing. His staff, they were able to walk me through the radiation treatment, which occurs there, how often it has to occur immediately following the surgery, and it was a painless procedure.
And treatment is started.
The SRT is what they call soft radiation. The radiation only penetrates 5 millimeters below the surface of the skin, so unlike other radiation devices that penetrate all the way through your body and destroys or damages everything in between, the photon X-ray technology that we have with the SRT is better known as tissue preserving technology. So it doesn't destroy all the tissue around, all the healthy tissue. It only attacks the tissue that needs to be attacked and needs to be eradicated from that portion of the skin.
I would absolutely suggest Dr. Jones and Lexington Plastic Surgeons to anyone suffering from keloids. That based upon the knowledge that his staff, Dr. Jones and his staff has regarding the issue, I would think that he's one of the premier or leading individuals to help treat such a symptom.
One of the perks of working out and keeping yourself fit is that you are able to showcase your physique, taking pride in your appearance.
Well, I can certainly empathize with Joseph. It's why many of us, including myself, stay in the gym and watch our diets. And he works out a lot. He wants to be able to show that off. So we just heard Veronica and Joseph's stories and their determination to find answers to treat the keloids that they're both suffering from by eventually seeking treatment from a medical professional. But I've heard so many stories about people who try to treat their keloids using unconventional methods, things that their parents taught them. How dangerous is that?
Very dangerous. As a surgeon, I've heard countless stories of patients trying homegrown remedies to remove keloids. Everything from people tying a string around the keloid in an attempt to snap it off, to cases where patients have left the string around the keloid to strangulate it in hopes that it will fall off.
Wow, and that's certainly the opposite of what people are hoping to get from it.
Absolutely.
Now, I've also heard that massaging the keloid can make a difference. I've heard you say that to many of your patients. What does that do to help the keloid?
I strongly recommended massaging to my patients at Lexington Plastic Surgeons, especially after a patient has undergone keloid surgery, or any surgery for that matter.
The benefits of massage therapy is, of course, what led you to spend 10 years developing your own topical cream to treat keloids. It's called Keloid Care. I know I've used it on my hands, and in fact, I use it on everything. Anytime I have a scar, but I remember one burn that you treated for me, and I think it was on this finger, and
it's gone.
It's gone. You can't see it anymore. So it helps not only, I guess, with keloids, but also with scars.
I developed Keloid Care, combining many of the natural ingredients our grandparents used to tell us worked for any kind of skin ailment, such as vitamin E, aloe, shea, and cocoa butter. And then I added ingredients which have been clinically proven to reduce the appearance of scars, such as hydrocortisone, silicone, and antioxidants, to come up with a cream that we have seen tremendous results with in people with tough scars and keloids. We have found the best results when Keloid Care is combined with surgical removal and post-surgical radiation therapy.
When a patient elects to have surgery with you, to enhance or correct something on their body, what do you have to consider before performing surgery?
As a cosmetic and reconstructive surgeon, I believe it is extremely important that I take time to understand the needs and desires of that individual patient. Every aspect of their surgery has to be considered.
So there are always questions and concerns, I guess, when considering how to treat a patient, especially one who's suffering from keloids, I imagine.
Absolutely. In fact, it couldn't be truer for my next patient, a teenager named Akila Brown.
I had my keloid since May 17th, 2013. On that day, I actually got hit by a car with my best friend. She actually died on that day, and when I landed in the car, it formed a keloid.
Akila is a very thoughtful, caring, intelligent, very active, enterprising young lady. The way she's dealt with the accident that happened last year, she's been more than I could even have imagined. I don't know if I could have been as strong as she has been this last year and a half.
I didn't know what my injuries were, so I didn't really think it was that big of a deal.
Akila went through, I think, 7 operations.
I first noticed a keloid, I think, 3 months when I was in the hospital.
Personally, it wasn't that bad to me, but I know Akila felt very, very self-conscious about it.
What we're going to basically be doing is just cutting very close to it, so we don't want to make it much longer than it already is.
The keloid made me feel very insecure about myself because it was just this bump on me that like I didn't ask for. I just didn't like taking pictures and like being seen, really.
I knew very little about keloids except when I was in college. I belonged to Alpha Phi Alpha fraternity. A lot of guys got brands, and some of those used to keloid. Mine didn't, but and it was ugly.
So when I came back to school, everyone was talking about prom already, and this was like October. And then I started figuring out about it. I'm like, I need to get this bump off my chin because I'm not taking pictures with this bump on my chin. So I thought I can just buy creams and it'll be done with. But then I realized that I needed surgery for this.
We found Dr. Jones in the AM New York paper. I was honestly impressed because he was a man of color, and I thought he would be more sensitive to what she needed to have done.
The surgery was very simple and easier than all the surgeries I've had.
Akila's mood before surgery was being anxious in a good way. She wanted to get it done. She was anticipating the keloid being removed. How you feeling? I know you don't like, I know you don't like all this mushy stuff. It's all right.
The first thing I look at when I'm in the mirror, I look at where the bump used to be, and I'm saying, thank God I got the bump removed because I don't have this thing on me anymore.
I think most teenagers, especially girls, they are very conscious of how they look, which is understandable. That was an impediment to her self-confidence. Once that was removed, you can see, especially now, since it's been a year and a half, there's no remnants of the keloid being there.
I would recommend Lexington plastic surgeons and Dr. Jones because they're very professional with me.
Dr. Jones, from my perspective, is a very professional doctor. The aftercare, especially, I believe is well done. It's very well organized.
I have to say, I really just love Akila's story. Since her operation, she has been able to regain the confidence that she needed to attend her senior prom, take pictures, and celebrate like a normal teenager. And now I hear she's actually a student at Penn State University.
Yeah, she's doing really well, and I know that her father is extremely proud of her.
Well, thanks to you. Well, we've learned so much on how you treat your patients who suffer from keloids, and your patients that we've met, Cynthia and Veronica, Joseph and Akila, are obviously just a few of the many success stories from patients treated at Lexington Plastic Surgeons. If you or a loved one is suffering from keloids, or someone you know has a keloid and is bothered by it, concerned about it, you no longer have to suffer from silence or shame. There's no need to feel the reluctance or the apprehensions about having it surgically removed. As we've learned here today during our show, Lexington Plastic Surgeons now offers new and innovative treatments for keloids that can prevent them from coming back. And whether you need a facelift, a breast augmentation, rhinoplasty, tummy tuck, Brazilian butt lift, mommy makeover, scar revisions, or if you're currently suffering from a keloid, we would love to hear from you. Call Lexington Plastic Surgeons. The number is located on the screen below. And make an appointment and let the staff evaluate you and determine the best treatment for you or your loved ones. For more information, you can log on to lexingtonplasticsurgeons.com or call the number on the screen below.
Without that keloid there,
It's just amazing the change that it has on her. She has the opportunity to walk around and be free.
My keloid is located in the back of my neck, and I noticed it started growing. Got an appointment, and within a week I was sitting in the office, very professional. I was like, oh, I love this place. I made a decision that now I can finally put a bathing suit on. You know, I don't have to have people stare at me. Thank God that I came across Dr. Michael Jones. He just changed my life.
Today, you know, when I look back, when I initially found out that I had scars and I would keloid as a result of those scars, I thought it was something that would be with me for a lifetime, and that there was no means of having those scars removed. Today, you know, through Dr. Jones and his staff, I realized that there are opportunities to have those scars removed, and that it's not something that you're forced to deal with, that you do have options. My overall experience with Dr. Jones and Lexington Plastic Surgeons, it was great. His staff, again, very helpful. His staff gave a very comfortable or inviting environment, which you know, helped to ease any concerns, especially going in to having any type of surgery, and it's something that I really appreciate.
My knowledge about keloids now is greater because Akila is going through this. I've actually done some research online regarding keloids, how they form, why they form.
As a teenager going to Dr. Jones' office, Lexington Plastic Surgeons, the staff there was very sweet and very understanding of my problem that I had with the keloid.
I have seen some of the work that Dr. Jones has done online, as well as some of the interviews that he has done. And he's an impressive man, and Lexington Plastic Surgeons are very impressive as well.
Before Cynthia had the surgery, I knew nothing about keloids. And after her surgery, I knew some things about keloids. You know, that it's painful, it's sensitive, you know, and she has her confidence back. That's really all that matters.
I would recommend Lexington Plastic Surgeons and Dr. Jones to anyone, especially if they are not quite sure of a doctor to go to pertaining to keloids. That would be the best option. It's Lexington Plastic Surgeons and Dr. Jones, because they are phenomenal and they will not regret it. They will not regret it.
As a doctor, it's always a joy to know that you have helped your patients. I strongly recommend for anyone suffering from a keloid to seek out the advice of a medical professional, such as Lexington Plastic Surgeons. Come and let us evaluate and determine the best treatment for your scar or keloid. Remember, at Lexington Plastic Surgeons, we have set out to make sure we are doing all that is possible to minimize the risk of a keloid occurring. We now have these wonderful revolutionary types of treatments that can effect a cure. Besides using the latest technology, Lexington Plastic Surgeons is one of the few surgical offices in the country to provide keloid removal while utilizing the SRT 100, which dramatically reduces the recurrence of keloids. In fact, to date, we have had over a 90% success rate in treating keloids with surgery followed by SRT. Speak with one of our staff and receive medical advice that helps you regain your outer and inner confidence. Thank you for joining us.
This program was sponsored by Lexington Plastic Surgeons.